recognizing excellence, innovation, and achievement for healthcare professionals in Utah. Today's event is sponsored by Roseman University of Health Sciences, Digital Bytes Production and Design, Web, PAX, and CHG Healthcare. And now, please welcome your Master of Ceremonies, Editor-in-Chief for Utah Business, Melanie Jones.
Good afternoon to everyone, and thank you for coming today. On behalf of Utah Business and Roseman University of Health Sciences, I'm pleased to welcome you to this special event where we spotlight the healthcare heroes in our community. We would like to thank our sponsors for making today's event possible, our presenting sponsor, who also hosted the beautiful VIP reception last week, Roseman University of Health Sciences. Thank you as well to our other sponsors for today's event, Digital Bytes Production and Design, Web, CHG Healthcare, and PAX. We appreciate all of your support to recognize and celebrate these fantastic honorees today. For 25 years, Roseman University of Health Sciences, a fully accredited private nonprofit university with campuses in South Jordan, Utah, and Henderson and Summerlin, Nevada, has been transforming education, reimagining healthcare, embracing discovery, and making a lasting impact in our communities. From their humble beginnings as the Nevada College of Pharmacy to becoming a leader in healthcare education and research, their journey is one that has touched countless lives. Roseman University is training the next generation of competent, compassionate healthcare providers in nursing, pharmacy, dentistry, and graduate studies, as well as providing high-quality, affordable dental care to underinsured and uninsured Utah families. Please welcome Chancellor for Roseman University of Health Sciences, Jeremy Wells.
Thank you and good afternoon. We at Roseman University of Health Sciences are so grateful and humbled and excited to be a part of this significant event. As a nonprofit university of health sciences, our mission is simple. We strive to improve the health and wellness of the communities we serve. We do this perhaps most directly by educating competent, compassionate students in dentistry, pharmacy, nursing, biomedical, and pharmaceutical sciences. We also strive to fulfill this mission by providing free or dramatically reduced health care to those members of our community who are most in need. And lastly, we receive help in fulfilling our mission by aligning ourselves with people, events, causes, and other organizations that share in our mission, because they motivate us to improve and to be better. And that's exactly why we're so excited to be a part of Healthcare Heroes, because we get to associate with you awardees who motivate us to be better. One of the great perks of being one of the primary sponsors is to host the reception, as was mentioned. And what's great about that is we get to meet the awardees and their families and friends and others in a more informal setting. And as we've done this for the last few years, I've noticed two observations. First, the awardees are always surrounded by great colleagues, family, and friends who support them. And so we appreciate all that you do. And then secondly, the awardees, while we're all concerned about improving the human condition in the globe, these awardees focus locally, and they strive to improve each person that they come in contact with. And I think that's a great lesson. My mother used to always say, to bloom where you are planted, or to be where our feet are. And yes, there are needs in distant lands, but there are also certainly needs here in our community. And I'm so grateful for you awardees and for the example you share in reaching out to the one and in serving our community here and making it a better place. We certainly look forward to the whole program and to learning more about the awardees. Again, thank you and congratulations. And again, thank you for being such an inspiration and example to me and all of us. Thank you.
Thank you so much, Jeremy. I'd also like to thank Lynette, Hannah, and Hayden, who have thought of every detail to make this event beautiful today. At Utah Business, we are committed to fostering connection, insight, and recognition for Utah's thriving professional community. We use our platform to highlight Utah's business leaders and success stories. We're all in on Utah, and we can't wait to tell your stories this morning. Those working in healthcare serve in a variety of roles: administrator, physician, educator, nurse, innovator, but they all share a dedication to helping and healing and a commitment to improving the quality of life for their patients. From newborns to accident-prone teenagers, from adults working to improve their health to those facing serious illness, healthcare heroes touch us all. Each of the heroes we're celebrating today have shown a special passion for healthcare, and we appreciate all you have done. So congratulations to all of you for doing what you do, working long hours, saving and improving lives, and putting others' needs ahead of your own. Your work, especially here in Utah, is invaluable, and we thank you for it. We're now pleased to move to the awards part of today's program. We would first like to recognize the honorees in the Administrative Excellence category. Please turn your attention to the video screen to learn more about these individuals that play a special role in the behind the scenes of the healthcare industry.
I am very grateful that over the past several years I've had the opportunity to be able to work with the state of Utah and several legislators and Intermountain Health to be able to intermingle two different programs. One program is called Empowered, housed under Roseman University, and the second is called PATH, and that's housed with Intermountain Healthcare. And PATH is able to provide medical care for our clients, which are pregnant postpartum individuals experiencing substance use disorders. And then Empowered provides wraparound services. And wraparound services are things like care navigation, peer support from someone who has lived experience. We provide counseling services and also community building activities. And together, these two programs support our participants on their road from recovery to stabilization to resiliency. It's really important to know that when we talk about pregnant and postpartum individuals experiencing substance use disorders, that drug-induced death is the leading cause of death for individuals of reproductive age. And it's preventable by screening and providing brief intervention and referral to treatment as healthcare providers. We can save lives by identifying those with a substance use disorder, identifying those at risk for developing a substance use disorder, and connecting them to appropriate treatment.
Please welcome to the stage Andrea Peterson, Executive Director of the Empowered Program at Roseman University of Health Sciences.
Initially drew me into the healthcare field was I was young. I started when I was 15. I got my CNA, my Certified Nurse Assistant, and I started working at our local care center, nursing home, and it really just drew me in. I loved it from the first time. Then I went into the hospital settings, so it was more short-term setting, but I just really loved being able to provide care. Now I'm in an administrative role, so I like improving processes so folks can get the care they need, and it's a good experience for them. You know, what's inspired me is I like to be well-rounded because I have done everything. I've been a CNA, a medical assistant, a EKG tech, a phlebotomist, administrator, a therapist. I just like having a little knowledge in everything. I like helping others, like whether it's my mom or my family or friends. They always have questions, and I want to be a resource, even if I just know a little in each area, you know, whether it's a billing question, a therapy question, a EKG question. I just know enough to be able to really be a resource to a lot of people.
Welcome to the stage from Rocky Mountain University of Health Professions Foundation, their Assistant Director of RMU Clinics and Revenue Cycle, Jessica Morris-Ryan.
And so I was around healthcare, but can't necessarily say as a kid I dreamed of working in healthcare. Certainly not in nursing homes. That's not an area of business that I think most people grow up wondering or hoping one day that they'll be in. And a brother of mine actually decided that he was going to pursue that path. And I went down and I spent 2 days with him. I got to see and feel and smell and be around the healthcare environment, and particularly nursing homes. And our sector is such a unique sector where we're able to be very forward-facing. The administrator of the facility gets to be very intimately involved in the care and care delivery with staff and their lives, and that resonated with me. The advice that I would give to people is to spend time understanding the sector of work you're going to get into. If you're passionate about healthcare, if you're passionate about taking care of people, spend the time to go in and kick the tires a little bit and see what part of healthcare, because there's so many different paths you can take to ensure that you're finding one that matches your passion and your skill set best. That's the experience that I had, and ultimately led to me finding the post-acute spaces where I felt I could offer the most, and in return I could get the most out of my career.
A round of applause for the President and COO of PACS, Josh Jurgensen. Let's learn a little more about the individuals who are involved with community outreach. Please turn your attention to the video screens.
About 10 years into my career, I found myself in a hospital bed, actually, for an entire week after an accident. And there was something about that atmosphere that felt like home. That pivoted my career into healthcare. And healthcare has such a tremendous impact on an individual's quality of life. And I've loved being a part of that. I would love to see a future for healthcare in Utah where one's zip code doesn't determine the longevity of your life, that everyone, regardless of where you live, that you would be able to have a roof over your head, that you would have food on the table, and that you would have access to the resources you need, dental care, mental health care resources, a medical home where you're getting to know your providers. That, to me, is the utopia of healthcare, and something that healthcare is working really hard toward right now by addressing social determinants of health. That's my passion. I want people to have a long, fulfilling, joyful, comfortable life, and the mission at Select Health and Intermountain Health just resonates with me so deeply, and that's to help people live their healthiest lives possible.
Congratulations to Dawn Wright, Director of Community and Public Relations at Select Health.
Public health is all about prevention, and it's very rewarding to know that the investments that we're making in our efforts to prevent disease and chronic illness really can pay off to improve the quality of life for Utah County residents. We can help prevent injury, we can help prevent symptoms of illness, and we can even prevent the ill effects of infectious disease or chronic disease through the work that we're doing through our over 150 different programs and services that we offer to the public. I think the most important thing that I would like the public to know about the field of public health and the workforce that's serving in this area is that we have a team of dedicated and compassionate passionate individuals whose sole purpose is to monitor the health of our community and to respond in ways to help protect public health and the environment and the communities in which we live. Most people don't know the vast variety of things that we do in the background quietly to ensure that we protect their health and wellness.
Accepting on behalf of Eric S. Edwards is Tyler Plew.
When I think about health, I think about all of the things that drive someone's health, whether or not they have safe and stable housing, whether they know where their next meal is coming from. So I'm really proud that I've been part of the work of Intermountain Health and part of the work of Utah that really recognizes the multiple drivers of health and makes sure that as we serve people, we're asking them, not just checking their blood pressure, but saying, do you know where your next meal is coming from? And assisting them in getting that meal, because that will improve their health as much as, if not more so, than the high blood pressure medication. I've worked in the healthcare field all of my career, and I'm really dedicated to ensuring that we have healthy communities, that everyone has equal access to healthcare, and that everyone in our communities can thrive. So it's the mission of health and the mission in particular of Intermountain Health of helping people live the healthiest lives that draws me in.
Congratulations and welcome to the stage the Vice President of Community Health with Intermountain Health, Lisa Nichols.
My first job out of college was working at the 4th Street Clinic, the homeless clinic downtown. My next job was I worked at a community health center downtown helping people apply for Medicaid or CHIP day in and day out, one appointment after another. I then worked for another nonprofit, Utah Health Policy Project, building out a statewide program that helps people apply for and access healthcare. Just with the things that I saw, the stories that I heard, I took that and pushed for change where I saw we could make a big difference in people's lives. One of the things I'm most proud of that we've accomplished at U of U Health Plans was after talking to different refugee service organizations about the challenges they see and the challenges that refugees see, they said even though a refugee has health insurance, that doesn't mean that they know how to use it or that they can get to their doctor's appointment. So we took that back, we looked at our budget and we said, you know what, instead of buying these squish balls and slap bracelets and things that just end up in the trash, let's use that money to create a program where if any refugee has our Medicaid program, they can get a ride to and from their doctor's appointment and we'll cover the cost of that. And I hope that's made a big difference in people's life.
To our final honoree of this category, congratulations to the Community Outreach Manager for University of Utah Health Plans, Randall Sear. Let's give our community outreach honorees another round of applause. You may have noticed the QR code in the middle of your table. For timely updates about upcoming Utah business events, as well as local business news, please subscribe to our free daily email newsletter by scanning that QR code. Additionally, as an attendee at today's luncheon, we want to give you a complimentary one-year subscription to Utah Business Magazine. Subscription registration is also included in that same QR code on your table. Now, please turn your attention to the video screens to learn more about our next honorees in the Healthcare Educator category.
For advice that I would give those that are just coming into this field, I would say, one, make sure that you're using your intuition. Get to know it really well. Number two is I would really look at taking a risk at what jobs that you're going to look at, because you never know where it's going to lead you and how it's going to help you throughout your career. And number three, really leave a good impression with each employer that you're working with, because it's going to help you move from one place to another and potentially not even have to use a resume to be able to hire someplace else. It has been 30 years, 1994 was the last time that I actually submitted a resume where somebody hired me because of my resume. Ever since then, it's been because somebody has referred me to a job, or somebody said, Allison, please come and work with us. So really leave a great impression, and it's going to serve you tremendously. What's going on right now is we see a lot of problems within the behavioral health community, and a big need, especially for kids. You know, we've got big problems with depression here, and children in particular. And that's something that's going to last a long time. So I would love to see, you know, really great access and the willingness to go see somebody when the need arises, so that you can really deal with those things in the moment rather than taking it with you for the rest of your life.
Congratulations and welcome to the stage, Allison Johnson, Manager of Clinical Consulting with Regents Blue Cross Blue Shield of Utah.
I like to say that we're a happy place for boobs and babies. That's what Breezy Babies is all about. We offer in-home and telehealth lactation care for families from the comfort of their own home. And we like to make the transition from pregnancy to postpartum nice and breezy. What drew me into the specialty of focusing on lactation is when I first started working on postpartum as a nurse, I didn't realize that a huge part of my job was going to be helping families with breastfeeding. I actually had no idea. And when I found out what an IBCLC was, at the hospital that I worked at, we didn't even have an IBCLC. If you don't know what an IBCLC is, it's International Board Certified Lactation Consultant. When I learned that this was a specialty that I could do hours and take an exam, I knew it was the right thing for me. I went down that path and I found that I actually loved helping families crush their lactation goals. It's just such a special time when you get to go help a family and help them through that time, no matter what their lactation goals are.
Please give a warm welcome to Brianne Taggart, founder and owner of Breezy Babies Lactation Consulting.
Came to college to be a recreation therapist and to help people with disabilities interact with, the world through the same opportunities that we have. And through that path of going to college and getting my master's, I felt so appreciative to all of the college student development programs that helped me develop as a person. And so when I came to the University of Utah, I wanted to create college student development programs to give back, like the way that I felt supported through my education. And through that, I ended up doing a postdoc in clinical trials and public health and just fell in love with research. I came to the University of Utah to work with students, and I left there passionate about using research to help others. One of the things that I tell my daughters are, they're like, Mom, help me figure out what I want to do in life. And to me, it's two things. You either have to find something that allows you to be creative and imaginative, or is it to help people? And that's what drew me into the healthcare system is, you're allowed to have both of those things happen through innovation and supporting patients.
Please welcome to the stage the Vice President of Research for the University of Utah, Erin Rothwell.
What initially drew me to healthcare and really physical therapy, and this is kind of a saying within our profession, and that is it is the science of healing and the art of caring. And I think I recognized that right off the bat, that I really wanted to be involved in science because I wanted to be in medicine, but I also really wanted to be physical, hands-on, and really make personal connections with patients in a way that was just, it was a deep connection. And that's what physical therapy is. It's physical, you use your hands, and you can convey so much with your hands in that way. And so that's what drew me to the profession, to physical therapy. What I love so much about being a physical therapist is getting to see patients return to what they love doing. And then for students, it's knowing that I'm preparing the next generation of physical therapists to take it to the next level. So wherever I was, they're gonna bump it up, and that's just so exciting.
Welcome to the stage Associate Professor and Assistant Program Director for the DPT program at Rocky Mountain University of Health Professions, Miriam Cortez Cooper.
I teach anatomy, which is notoriously an extremely difficult course. I love watching my students push themselves intellectually and really challenge themselves and overcome that process of learning, thousands of Greek and Latin terms. But most importantly, my goal when a student steps foot in my class is that they will leave feeling a greater love and awe and respect for the human body. My greatest advice for a student coming in, especially a healthcare professional going towards a doctoral degree, would be to take care of their mental health. These students are coming in and they're pushing themselves to their intellectual limits, their mental and emotional limits, their interpersonal skill limits. They're leaving school with tremendous debt, and it's very important that they pay attention to their mental health and that they nurture themselves as they are preparing themselves to serve society. What I find most rewarding working in healthcare is watching my students fall in love with their own body. For them to see their body as beautiful, excited as they watch their hand move or feel their heartbeat or feel their pulse. They can make sense of all of that through this understanding of anatomy that they've gained.
Please give a warm welcome to Dr. Rachel Tomko-Novak, Associate Dean of Enrollment and Student Success and Associate Professor for Biomedical Sciences for Roseman University of Health Sciences College of Dental Medicine.
Comunidad Materna in Utah is a non-profit organization who supports expectant families before, during, and after pregnancy. We do prenatal classes, we connect them with resources, mostly we serve the Hispanic community in Utah. I think the rewarding part is to see their faces when they have answers to their concerns. One of our doulas was doing a visit with a mother, and she was obviously stressful about the situation. And even this doula mentioned, I see their face after we told to her, providing the resources, the comfort that she found in the information that we provide. And that I think make us, feel that we are doing our mission. Some of our families, they don't have family around them. So being in different spaces and places is hard many times. So, but seeing that faces is what we make us feel, fulfilled.
Please give a warm welcome to our final honoree in the Healthcare Educator category, Mayra Abish Sanchez Gomez, Executive Director at Comunidad Materna in Utah. Let's give them all one more round of applause. Now we will find out a little more about our honorees in the next category, healthcare practitioners. Please, once again, turn your attention to the video screens.
So what initially drew me into healthcare and podiatry specifically was I like the specificity of podiatry. I like how focused I am on one body part and be able to become an expert in that. And healthcare in general, I don't know, I've always known I was going to be a doctor. I was actually a nurse first as an RN, and then I knew I was going to go to medical school and just kind of fell into this pathway of podiatry, and I love it. It's so focused on one body part, but I'm almost like the primary care doctor of the foot and ankle. So I can do surgery, fix an ankle fracture, but I can also help someone with diabetes that has peripheral neuropathy and everything in between, skin conditions and nerve problems, and I can do ankle arthroscopy, and I can do ingrown toenails. So I just love the variety, but also at the same time the focus. I find most rewarding about working in healthcare and being a podiatrist just being able to help people feel better. I mean, on a day-to-day basis, I'm able to find a problem, help solve it, and then see people happier, doing more, and that's really rewarding.
Dr. Benjamin Thomas couldn't be here with us today, but here to accept the award on his behalf, please welcome his wife, Laura Thomas.
I'm not saying, but I do have a gift of being able to see the value in people. And I really, truly come to love the patients that I am helping. And I think that that's initially what drew me, is I like people, I like to help people. The relationship that you build with patients, you get to see really sensitive and tender moments and things that you wouldn't normally see in someone that you just met. But it allows you an opportunity to look into very private and sensitive parts of their life, and you build a relationship around that. And so that's one of the most rewarding things, I think, is the connection that you get to make with people that you're trying to help.
Please give a round of applause for Emily Johnson, Integrated Family Nurse Practitioner for the Rosa Clinic and Utah Navajo Health System.
What drew me into healthcare was helping out family when they'd gotten sick with some Alzheimer's, and later on it was matching or blending science and art into helping people. The most inspiring part of my job and my favorite part of the job is getting to help people in my community in an environment that I love. Early on in my career in the ER, it seemed like I had asked a lot of very stupid questions, especially to physicians and very senior nurses. But everyone realizes that if you're asking a question, it's coming from a place of wanting to learn and wanting to help the patients in the ER and to protect those patients. It's easy for clinicians, especially experienced clinicians, to forget that we came from somewhere once. And so what I do to help brand new people coming into the healthcare setting, whether it's flight medicine, emergency medicine, critical care medicine, is to help foster an environment that they can ask those questions that they may think is stupid, and to provide an opportunity to learn when I can.
Congratulations and welcome to the stage, James Venati, flight nurse for Air Methods.
So what drew me to the healthcare field? My grandma, she had a stroke and ended up in the ICU at the University of California at Los Angeles. And we drove up there. It was, I don't know, an hour from where I lived, and went on the way back. I remember seeing her in the ICU looking quite ill. On the way back, my parents were speaking highly of the surgeon who had helped save her life. And ever since that day, driving home, I was like, you know what? Hearing my parents talk about her feeling, or the surgeon, and feeling like they had saved my grandmother's life, I just felt like that's something I wanted to do. What I find to be the most rewarding part of my job is definitely patient interaction. I love interacting with the patients, getting to know people, people from all walks of life, different stories. In this day and age, they often have a video of how they got hurt, which can be fun to see, and hear the backstory of how they got hurt. As you follow up with them after surgery, seeing how they improve is super rewarding.
Please welcome orthopedic surgeon at Revere Health Orthopedics and Sports Medicine, Kevin Christensen.
Legacy Health it's a primary care setting. So we have primary care physicians, nurse practitioners. Anybody can walk through our doors and we will see them, but we focus on and have more training in LGBTQ health, which is often lacking in medical education these days. Unfortunately, the whole medical system should be up to speed about, but they're not. So our patients have been searching for providers that really know what they're doing in this space. That's really what we have to offer the community. It's a safe space to receive really high quality primary care. The majority of my family is in medicine, so I think I kind of just knew, hey, that's really cool. I saw all of the amazing impacts that they had on people. So I went into college wanting to do that. I hated chemistry, so I wanted to not be pre-med anymore. And then I volunteered in a heart-lung transplant unit when I was an undergrad, and there was a little girl who was on a heart-lung transplant machine. The machine was keeping her alive, and it kind of just hit me like, I can get through chemistry. Like, there's bigger reasons to put in some work in order to help people like that.
Please give a warm welcome to physician for UAF Legacy Health, Matt Bryan. We have now one honoree in the healthcare support category for her work as an AirLife helicopter pilot. Please, once again, turn your attention to the video screens.
I was initially graduating high school, didn't know what I wanted to do with my life, and I asked my dad what I should do for a school project on how to basically a career path that I could consider in the future. And I had no idea. 16-year-old me asked my dad what he would do. He said that he wishes he could have been a pilot. So next thing I know, I'm thinking, oh, okay, Air Force or airlines. I actually started my career planning on going and being like a Delta Airlines pilot. Started that when I was 18, got very bored. Realized that flying planes wasn't for me and I needed something that was a little bit more of a challenge. And so then I switched the helicopter route and followed it up, flight instructed, did tours of the Grand Canyon, flew offshore oil and gas in the Gulf of Mexico, and then I was finally able to achieve the flight time required to enter the air ambulance field. And then the healthcare field I find very rewarding. I've been flying for 16 years all over the country, and being able to use those skills to actually help people is the next level. It's the next step. It's really taking the machine, the helicopter, and doing what it was supposed to be able to do.
Congratulations and welcome to the stage, Jennifer Prince, Air Medical Helicopter Pilot for AirLife Utah. We're now excited to move into the innovation category of honorees. Please once again take a look at the video screens.
I love how in healthcare the focus is on the health and well-being of the individual, the patient, their family, their loved ones. We hold an annual summit each year here in Salt Lake City, where we invite all of our clients. Now we work with over 700 organizations that are all in the healthcare delivery ecosystem. And we spend a couple of days together sharing experiences where we've been able to use data and analytics to make healthcare better, to make better decisions, to see outcomes actually measurably improve. And that gets back to that original goal of all of us that are in the healthcare delivery ecosystem, to make healthcare work just a little bit better. And throughout those couple of days, we literally hear hundreds of examples across the world of organizations and individuals who are leading that data-informed change to make healthcare a little bit better. And it's really an opportunity to showcase the real healthcare heroes, those that are on the front lines, the clinicians that are making better decisions and so dedicated to the care of their patients.
A big round of applause for the CEO of Health Catalyst, Dan Burton.
To give you a little bit of background, so prior to joining Nusano, was a professor in the Department of Radiation Oncology at the University of Washington in Seattle. And there we would produce some of these isotopes that Nusano would be producing. But it was done at a much smaller scale. So Nusano's groundbreaking technology allows us to produce isotopes with our technology that's at a scale of about 10 times the rest of the world combined for the type of accelerator we have. You know, it was really exciting when I joined Nusano to see this opportunity and see what kind of impact it could make on the world. So my advice for somebody just entering the healthcare field would be to make sure you think about it creatively. There's lots of different ways that you can impact healthcare, from the science and R&D side of things to treating patients as a nurse or a doctor. I think making sure that you keep your eyes open and find what niche is best for you is going to be really important. And I think a lot of that comes from exploring, from volunteering, getting involved in many different causes that touch the healthcare system.
Congratulations and welcome to the stage, Nusano's Director of Target Development, Greg Moffitt.
I had mentors in my life and people that helped me. And whether they were medical professionals, I always think about, like, my second dad was my family care doctor that I had for forever. I grew up in a small town, and he played such an important role in my life. Seeing that there's a profession that I could be in where I could be continuing to influence and help people in their lives and being healthier is a piece that really drove me to get into this field. And then along the ways, when I decided to work into the mental health field, that's the place I took. My wife is a nurse, and so I think about that as well too, as I watch her in the past in hospitals and other things, and just seeing it takes all of us in this community to work together and to help each other. When I think about what is most rewarding working in this space, I always reflect and go back to the privilege it is to be able to hold space with someone and be a part of their life and their journey. And knowing that they are trusting us to try to help guide them, and that they're willing to share these very intimate and personal experiences in their lives, I think is kind of a sacred opportunity and something that's also very rewarding.
Please give a warm welcome to Jeffrey Ainsa, Senior Director of Clinical Services for Evolved MD.
One of the cool things about my role at Master Control and our role as a team is we get to interact with the quality professionals who are the ones that are making sure that the products that you use at a hospital are delivered with high level of quality. And these people have so much sincerity to them. So, like, even though they're not the actual providers, in a way they are, they're like the stewards of a big part of the healthcare that you're going to receive, right? Which is the products that you're going to use are going to be put inside your body. We have a great set of unsung heroes out there that are really making sure that when you go to the hospital that you have a high quality product. Medicine is becoming more personalized and more complex with artificial intelligence and the ability that we'll have to design and bring new drugs and treatments to market. These all have to get through this complex regulatory process. And so our goal is to really continue to innovate and to build software and a system that will help reduce the barriers to getting through these complex regulations to get to the people that need the products, right? So this amazing drug pipeline that will be created from all the innovation that we're seeing, getting that to market, getting that to people sooner so that we can save lives, that's really what our vision is.
A round of applause for our final honoree in this category, John Beckstrand, CEO for Master Control. Before we bring up our final honoree of the day, let's give a big round of applause for the fantastic wait staff at the Grand America today. Now, please turn your attention to the video screen one last time to learn more about our Lifetime Achievement honoree.
Our goals for the future of healthcare is really to help the communities that are going to be in dire need of receiving care from physicians. We have been working extensively with large healthcare systems to find other ways to attract quality candidates, but also to re-engage perhaps candidates that have retired, semi-retired, finding ways to get them back into the system, whether it's through telehealth or doing part-time work within communities that they have already been a part of. There are things that we are looking at to try to be more innovative as we start to address how do we take care of all of the patients across the U.S. and get qualified physicians to those locations. To be in healthcare is that you actually make a difference in people's lives. Although I don't provide direct healthcare, I know that every single day we are touching thousands of patients. And there are a lot of scenarios where if we had not found a qualified physician to be in that community, someone would either be driving 3 or 4 hours to receive that care, or they're leaving really their friends, their family, their home, and are not getting kind of that holistic experience of being able to recover and receive the treatment that they need.
Please give a warm welcome to Andrea Nelson, President of Vista Staffing and Ingenivis Health Company.
I just wanted to say a few words. This has been a really nice event, and it's really inspiring to hear about all of your stories and what has drawn you to healthcare. I know for the last 20 plus years, I've had the privilege of working alongside clinicians and healthcare providers across the U.S., healthcare systems, trying to find ways to remove obstacles to get patients the care that they need. We work extensively in communities that are struggling, and we will see more and more of that as we address physician shortages, as we look at kind of our situation with healthcare. But I find it really inspiring as I hear all of the accomplishments that you all have made and are continuing to make, that our future is bright. There's a lot of positivity. There's a lot of innovation. And I congratulate all of you, and I appreciate this award. Thank you very much.
Thank you for coming today to join us in honoring some amazing healthcare heroes. I do have a few housekeeping items to let you know about. As a reminder, your parking is paid for. You should have received a voucher when you checked in. If you did not, please make sure to stop back by the registration desk and they will have one for you. We do like to recycle our name badges. Please feel free to leave them at the table or drop them off at the registration desk. Thank you again for coming, and congratulations to the 2024 Healthcare Heroes.